So women taking testosterone, you think it could be a game changer for women?
It is a game changer for women. Man, this is a rabbit hole. I don't want to go too deep down this pathway, but we can if you want.
I think we should.
Okay.
Women are underserved, I think, in this TRT realm. You got the guys seeking it out, right? And then the guy goes to a place like Merrick Health or something like that. And he gets his blood work checked. Sure enough, testosterone's a little low. They give him some testosterone. Maybe they give him a couple other things. He's optimized. Now he's hornier.
Yeah.
Right? And that's not great for him to be, for his sex drive to be way up, while maybe his significant others is not.
It's incredible, dude. Like, they've left the women behind. I mean, I literally just did a podcast about this with the doctor. I can't remember who she was or what her name was, but I just did a podcast with her recently, and we talked about the WHI initiative and how it destroyed women's hormone optimization. And it's still, unfortunately, left this like stench, in the optimization healthcare space for women. In fact, most women who are postmenopausal, let's just qualify as 55 and older, aren't even on hormones, dude. And if they are on hormones, they're on estradiol and progesterone and not even given testosterone, which is the most insane thing in the world, because if these doctors, which again, unfortunately, as you know, allopathic medicine does not teach doctors how to hormonally optimize people because they don't learn that in medical school. There's no standard care of practice when it comes to hormone optimization. So the doctors that can do it, the Gabrielle Lyons, the Dr. Tanas, Dr. Elizabeth Earth, the people that know what they're doing, it's all from just, experiential body of work.
And women are commonly prescribed T3, thyroid medication.
Dude, it's so sad. But just to go deeper on this, so the WHI, which was the Women's Health Initiative, which again gave women, equine estrogen and equine hormones, and just screwed everything up. And then there were some studies, and the studies were flawed, and obviously the studies were also in comorbid patient population groups, which is always the case with studies. So you can never extrapolate comorbid sick people to healthy people, right, who are the majority of using hormones in their 50s, 60s, and 70s postmenopausal. So we're now at this time where the majority of women that are on hormones in their 50s, 60s, and 70s are not getting therapeutic testosterone. And one of my mentors taught me that giving a woman testosterone is like giving a dry plant water. And again, if we talk about the differentiation of the sexes, the difference, and again, so many people don't understand this, but the only difference between a man and woman is how much testosterone the uterus was, the zygote was exposed to in utero, right? So it's like, if it had a lot, it's a man. If it had just enough and a little bit more or less, it's a woman. And again, we talked about this on, earlier about like gender dysphoria and all this craziness that's happening. And all of it is related to an inexposure or an inadequate exposure of actually testosterone in utero. And I don't want to rabbit hole because we're talking about women right now, but women benefit from therapeutic testosterone more so than men do. And let me explain this. Why is that? Because a woman, when testosterone is not blocked, and again, we don't want to talk about that, but it's not blocked. It's allowed to aromatase through the aromatase pathway and enzyme into estradiol, which then becomes estrogen. A woman has her femininity and has her, normal divine feminine essence, which is what, gives a woman her power, her creative power. And when you don't give a woman testosterone who's postmenopausal, which means they don't have circulating free hormones anymore, they lose that divine, creative, feminine power because they don't have testosterone. And this is what is so confusing to so many people that are prescribing to, aging women / postmenopausal women, because they're giving them progesterone and giving them estradiol, but not giving them testosterone. And then they're also giving them like SDHEA and, dude, I see it all the time now, plant-based natural hormones. I mean, it just gets crazier and crazier. But like, if you give a woman, and and I've been doing this now for a while, this is my gradient or criterion for women. And by the way, a woman who's who still not perimenopausal and is, still in, ovulating and childbearing years, they can take testosterone too. So the criterion from an injectable testosterone standpoint, and by the way, there's other formulations. You can give a woman transdermal. They can put it on the clitoral head or the intravaginal lips. It absorbs very, very close to the bottom of the man's scrotum, right? Because it's very it's very, very percutaneous there. You can actually absorb testosterone there faster than any other skin location. So again, if a man is using therapeutic testosterone transdermally, he wants to put it at the base of his scrotum, just as if a woman's using transdermal, they want to use clitoral head or intervaginal lips. But we've found recently, and this is the doctors that I work with, and of course my business partner, Hunter, that women who inject therapeutic testosterone, just like a man would inject testosterone, but use 1/10 or even 1/15 to 1/20th the dose that a man would use for therapy, have the same profound and pronounced life-altering transformative effects that men do, and oftentimes even more. So what does this mean? So this is kind of our pet theory. It means that if you're perimenopausal or postmenopausal women, because I don't like giving recommendations for women that are under, but they can benefit from this and they would use less. It's somewhere between 2 to 5 milligrams 3 times a week injected. Now, again, when we get into injectable delivery systems, we want to mimic the body's natural pulsatile release of testosterone.
Sorry to interrupt, but is it 2 to 5 milligrams per week, or is it 2 to 5 milligrams per shot?
2 to 5 milligrams per shot. So it's a good question. So that means, like, again, if this woman is perimenopausal, which is like most women in their late 40s and early 50s, they still menstruate, but it's not regular. You know, they have like invariable periods or menstrual cycles. And what that means for people listening is like they may menstruate for 45 days and then not menstruate for 4 months. And then it comes back, right? That's literally perimenopause in the beginning of it. Postmenopausal is when they stop bleeding. There's no menstruation. And in women that have hysterectomies, which by the way is literally sexual castration in women, that's what it is. And unfortunately, the allopathic medical system loves to have hysterectomies. They love to do these things and remove women's ovaries and remove people's uterus. It's insane. But at the end of the day, when they do that, they have no hormones. And so now, in order to be feminine, they need a larger or higher dose of testosterone for the testosterone to aromatize into estrogen. So they have estrogen. So it's somewhere probably, and by the way, my wife is 53 years old. She'll be 54 in November. She's just 9 months younger than I am. She is right now taking anywhere from 4 to 6 milligrams injected every other day. So I inject her Monday, Wednesday, Friday. She's now in Greece, so she's injecting herself. But it's very simple to do. A formulation that's perfect for a woman is a 20 milligram per milliliter formulation. Unfortunately, the compounding space right now is still trying to give women 200 milligrams per milliliter, which is insane because, as you know, that's like literally one tick on an insulin syringe.
It's hard to measure and see and all that shit.
Yeah, it's impossible. It's totally inexact. Exactly. It doesn't work. So thankfully, there are some pharmacies out there now that are doing 20 milligram per milliliter. And
Big Pharma's not doing this. This is compounding pharmacies only, is my understanding.
100%. And very truthfully, I'm sure Big Pharma will eventually, because they'll adopt and they'll see what the compounders are doing and they'll do it themselves. But very, very truthfully, we should talk about this because the improvement in delivery systems and therapeutic hormones in the last 3 years has been startling. And the reason that has happened is that they are now able to make these injectable preparations in very, very fine, very, very thin, permeable solutions, right? So you have MCT oil. There's a form of MCT oil, which you probably know the name of it, but I forget it. It's like a polymer of MCT oil, and it's basically palmitic acid. And it passes through a 29, 30, and even a 31 gauge insulin syringe that you can do IM, right? So like a woman can inject, 3, 4, 5 milligrams of testosterone 3 times a week anywhere on her body and not even feel pain and have no scar tissue. So this is a dramatic, call it profound advance in injection delivery systems. And it's also for men now too, because they're making a lot of men's in MCT oil too. But the bottom line is, if a woman takes testosterone 2, and again, 3 times a week to me is minimal, because again, you want to mimic your body's natural production. Some women maybe can get by just like guys do with 2 shots a week. But again, we want to keep that nadir like this. We want to stay straight. We don't want to have peaks and trials. They will literally have a life-changing, transformative experience. Like you said, if their husband is on TRT, now they're going to have the same elevated libido. They're going to have the same energy. They're going to desire and crave sex like their husband does, right? So it only makes a stronger relationship. It makes a stronger union. It gives the man and the husband and wife actually something more to bond over, because now they become more, introspective about each other's hormone therapies. So I've seen this in relationships dramatically alter for the better marriages and long-term relationships.
I think it's big for drive. You know, I think a lot of women are amazing, like especially mothers.
Yep.
You see how many tasks, you know, your wife does in a day. You're
nuts,
just like,
dude.
oh my God, you're working circles around me. But over time, you know, that amount of tasks and just sort of trying to figure it out how to do it naturally. And when your hormones are getting messed up from bad advice and bad medical practices and so forth, now you got to figure out a way to, I guess, you know, circumvent some of that. And you can do it potentially with some testosterone.
Let's talk about that, because I will tell you, and I've experienced this in so many of my friends' lives, so many of my peers' lives. Most women who don't become hormonally optimized, don't have injectable or therapeutic testosterone as they get older, literally can't have sex anymore. They cannot be lubricated intravaginally anymore. They're dry. And again, this is nothing against them not liking their husband or craving their husband or desiring their husband. It's literally because they are biologically defective, because they don't have circulating free testosterone and other hormones like estradiol, like progesterone going through their body.
Same thing with a guy not being able to get it up. It has nothing to do about love or like or someone being hot or any of those
It's literally a biological defect, and it's completely correctable, completely changeable. It's so crazy that we are still living in a society where people abhor this. There are doctors, you know, in allopathic, you know, call it sick care medicine, illness medicine, who hate this because, again, I mean, Mark, we know this, right? Like at the end of the day, they're going to prescribe a PD-5 inhibitor, a Viagra, a Cialis, a Levitra, and an SSRI to deal with the depression that these people have, both men and women, because they make far more money than just writing a script for, you know, testosterone vials. So again, be very cautious if you're a man or a woman and you want to do this, that you're working with a physician that understands this. But I'm telling you, like, yes, there are women out there that are using transdermal formulations of testosterone and they're having decent success. But if you inject, again, in these amounts, and I didn't give the postmenopausal, perimenopausal and before should be somewhere between 2 and 5. And postmenopausal should be somewhere between, I think, again, start maybe low at 4 and go all the way up to 7 to 8. But
this will help mitigate a lot of side effects.
All of it. I mean, but here's this crazy part. Like a doctor listens to this show right now and hears me saying this, and he's saying he's recommending 25 milligrams a week of testosterone for a postmenopausal woman. That's crazy. It's not. Because I've seen it in so many women, right? Like my private membership group is close to 700 people now, and like 300 plus of them are women, and they're all 40, 50s, and 60s-year-old aging women, health optimized, into biohacking, into, you know, improving their sex life, their husband's sex life, all that stuff. And every single one of these women that has started with this injectable testosterone protocol, even at the higher dosages, the postmenopausal women have come back and raved about it and said, it's changed my life. I feel better. My relationship is stronger. I crave and desire my husband when before this I wasn't. So again, it's like you said, man, women are underserved. There are not enough doctors that understand this protocol. They don't understand that injectable testosterone in a much lower dose is just as beneficial that it is for a man. But it's up to us and guys like you and me to literally tell people about this so that more people will take this or go down this path. And truthfully, if you're a woman and you're listening to this podcast, or your husband or your boyfriend is listening to this, and you tell your wife to listen to this, find a doctor that will get a 20 milligram per milliliter testosterone solution, because they're out there. Don't allow the doctor prescribing hormones to give you a 200 milligram per milliliter. And the other thing, and we should just mention this because it's not effective, pellets are worthless. There are plenty of people that are on pellets, probably men and women, who listen to the show and they're like, Jay Campbell's full of shit. You know, that's not true. Dude, I've seen this so many times in the last decade. Pellets are an unnatural delivery system. People, both men and women, they cleave testosterone cellularly differently. Some people are hyper excretors and they blow through a pellet. Other people take forever to blow through a pellet. So it never will universally cleave in the system like a testosterone injection or a transdermal delivery system is. So if you're listening to the show right now and you're using pellets, please seek out a better and a more effective and productive delivery system, which again, the two most tried and true are obviously always going to be injectable every other day. If you're super anal retentive and you can inject daily, which some people do, that's awesome, because that's going to mimic your natural production even more. But for the most people who travel and have a good work-life balance, every other day for men and women is the way to go.
And then what about body composition? Is going to be the same benefits body composition wise that men are enjoying?
It's actually, it's better for women because again, women have a much more sensitive endocrine system than men do, especially as they get older. Because remember, again, their testosterone is a lot less, but it's aromatizing into the healthy levels of estrogen, which makes them feminine. Women, so when you give them this testosterone as they get older, it's the only format of estrogen that they have now, because it must cleave and aromatize into estrogen. So you can't block it. You want it to be as healthy as possible. And that's why I'm telling you, postmenopausal women can even handle more. Like I've seen women in my group that are doing 40 milligrams a week. So they're doing literally like 12 to 15 milligrams per injection 3 times a week, and they feel amazing. And again, they're not getting virilization. They're not looking like a dude or having a deep voice or growing hair on their chin or anything like that, which again is so many stereotypes in the marketplace. That only happens to younger women who are bodybuilders, who are using gear, super physiologic levels, and already are doing things that are making them virilize. You will not see a postmenopausal woman virilize unless they literally take like a man's dose. You know what I mean? Like they'd have to take 500, 600 milligrams a week of testosterone or some stupid shit like that. And believe me, there are bros out there and coaches out there that are probably giving their women that because they're thinking like, oh, it doesn't affect her, you know, but it will eventually virilize if they take a high enough dose. But nothing will virilize a woman who's postmenopausal if she keeps her dosage in, 20 to 50 milligrams a week range.
And then how would a woman go about getting that prescribed? Like what would be the process?
I mean, it's honestly pretty simple. It's basically like, again, hopefully your doctor has an experiential body of work. They've been working with men and women. They've been optimizing men and women's hormones. And then it's just having that conversation like, hey, I listened to Jay Campbell and Mark Bell, or I listened to so-and-so talk about this, and I really want to start taking a microdose of injectable testosterone a week. Can you get me a 20 milligram per milliliter format? If they're a legitimate, proactive doctor, a progressive doctor, a good thinker, they'll say, of course, let's see what happens. And then they just kind of let them, go down that path and see whatever their dosage is. And again, it's always the same, Mark. Start low, go slow. Assess your unique individual tolerance to it. How do you feel? Again, we know that the 2-found goal of hormone optimization is happiness and balance, or joy and balance. So do you feel joyful? Do you have that pep in your step when you wake up in the morning? And do you feel like, you can tackle the day and have things? Because like you said, dude, women have so many responsibilities. And if they can be hormonally optimized as they get older, it only allows them to stair step all the things they have to do without complaining and actually running out of energy. But I think hormonal optimization for women is as important, if not more important, than it is for men. And no man should be on hormones without their wife also being on hormones. It's not fair.
And so for Mother's Day this year, don't buy your mom a bunch of chocolate. Buy her some testosterone. Strength is never weakness. Weakness never strength. Catch you guys later.
Peace.
Bye.